Hello again, everybody. It's me again, and I wanted to do a quick update because today marks 4 weeks since I had my surgery. I had my surgery on March the 2nd, and today is March the 30th, and this is what I sound like now. So, at least it's a little bit further along than what I was last time. I sounded a little bit like the gingerbread man from Shrek, so at least I don't have that anymore. But I'm actually quite pleased with how my voice is coming along. In fact, I wanted to tell you a quick story. A couple of days ago, Zan wanted to order food, and so I ordered some food from one of our favorite places, Fifi's Lunchbox, and I absolutely love Fifi's. Oh my God, I love Fifi's. And when I called, apparently they're kind of busy with this whole virus quarantine thing, and until we can actually go somewhere and eat in a restaurant like a normal person, we have to order takeout. And so when the gentleman answered the phone, he asked me if I would mind being placed on hold. And of course, no, I don't mind. And he said, "All right, ma'am, I'll be right back." And it was that word ma'am that really stuck with me, that in 43 years, he was the first person to ever call me ma'am on the phone. And I admit I got a little bit choked up. I didn't cry, I didn't break down, but I did get choked up. And I did finish the phone call and everything was fine. And I gave the guy a really good tip, and he has probably no idea why. Poor guy. But I don't know the guy. I didn't tell him my name. He doesn't know anything about me. He just heard me talk and he assumed that I was a woman. And that meant so much to me. That was so wonderful to have that happen. For those of you who have been asking, and there have been a couple, what I had done is called a gladoplasty with anterior web creation. I don't know what any of that means, but that's what the doctor told me it was, and that's apparently the procedure that I had done. I just referred to it as vocal feminization surgery, but evidently there's a much more professional sounding name, a gladoplasty. I don't know, that sounds really like something else. Anyway, I did talk to my doctor last Wednesday, and she informs me that I'm coming along very, very well, that I'm in a really good place as far as where she would like my voice to be. And so apparently I'm moving along quite well. Now, some of her patients after 4 weeks after surgery still can't talk. So much to the chagrin of those who work with me, I can actually talk pretty well, and people can hear me over the machinery, and I may have to repeat myself once or twice, but for the most part they can hear me, and that's at least something. But I also wanted to, again, say to everybody, I can't tell you how much I appreciate all your wonderful comments and your support and your love. It means so much to me. And I hope to do some more of these updates as things progress. And so you can see how I sound, a month from now, 6 months from now, and see how my voice turns out. But again, I'm hoping this is not the final result. But I have still vocal therapy to go through that'll help me sound a little bit more normal, and quite a bit of healing still to do before it gets back to a normal sounding voice. But as it stands, I can talk, I can communicate, and I actually kind of like how I sound now. And it's still a little grovelly, and I still sound a little bit hoarse, but I'm coming along, and I'm coming along fairly well. So I'm all happy. And I appreciate everything. I appreciate all your support, and I love you all. Have a great day. Stay indoors, wash your hands, and stay away from me. That sort of thing. I'll talk to you all soon. Bye.